Myeloma is probably the disease where we have been described the more important number of prognostic parameters. And so we have to try to categorize them to see which one are important. So, of course, we do have some prognostic factors which are related to the patient, for example, age, comorbidities, lines of treatment. We have more specific prognostic parameters related to the tumor clone, like cytogenetics, proliferation. And after that, we have prognostic factors which are identified only after treatment, which is response. And definitely nowadays, with availability of minimal residual disease assessment, it is a huge prognostic factor, and in the future it will be very important. We are just at the beginning of that because MRD has been described maybe 10 years ago with flow with a sensitivity of 10 to minus 4, and it was not sufficient to really identify the patients who will have a very good survival. So for now 2 years we have next generation flow and we have next generation sequencing, and with these tools we can achieve a sensitivity of 10 to minus 6. So when we are achieving this sensitivity, we are really able to identify the very good risk patient. And for example, in our last trial, a patient in CR with MRD less than 10 to minus 6, the 4-year PFS is 83% versus only 30% in patients who were in CR but not in MRD neg. So in the future, I think we will use MRD for different things. We will use MRD as a primary objective for the trials, for drug approval, for academic trials, and probably we will be able in the future to define the treatment according to MRD. For example, in a patients for whom we do achieve MRD negativity after transplant, maybe for these patients we don't need to have maintenance. And you can imagine the economical consequence of that, because if we can spare maintenance for maybe half of the patients, it will be important for the patients because all these drugs in maintenance, they are toxic, and for the society because the cost of this drug is very high, and especially if you are giving for years, if we can spare that for some patients, definitely we will do much benefit for the society, for the patient, but also I think with MRD we'll be able to identify the patient who are probably cured from disease, which is really new in myeloma now.